But in our first hour, I want to get into this question of health care in a very direct and rapid fashion, as it were. Dan Gainor is with us. He is the Vice President and T. Boone Pickens Free Market Fellow at the Business and Media Institute. businessandmedia.org is his website. Dan, welcome back to the show.
It's a pleasure to be back, and certainly we're talking about that which is on everybody's lips these days as Congress tries to mess up a viable healthcare system.
It is on everybody's lips. You betcha, as Sarah Palin would say. In this hour, 150 people in America will go bankrupt because of their health insurance bills. 140 of them will have been insured, and yet they will still go bankrupt. In this hour, in this day, 50 people will die for lack of access to health care. And that's an incredibly low estimate, actually, because that doesn't include all the people who probably could have survived had their condition been diagnosed earlier. That's just the 18,000 a year who die as a result of direct lack of access. How much longer? Let me ask this as a why. Why do conservatives want Americans to continue to die for lack of health care?
Well, that's a ludicrous comment. You know it is. It's just one of those.
Americans are dying right now, Dan, and you're defending a system that's killing us.
Well, the current system. I mean, there's no question that there's some problems with the current system. The solutions, will be worse. The solutions the Democrats are proposing right now in Congress will be worse. But let's talk about the current
Why
system.
is it that every other industrialized country in the world that has a national health care system has a longer lifespan than us, including Costa Rica with an average per capita income of $9,000 a year?
Well, let's see how many Americans are out there protecting them and dying accordingly as a result.
What does our military budget have to do with whether or not we should have a national health care program?
You want to take a look at? Well, you said you're talking about how long people live. Well, I mean, we've got a lot of Americans out there right now who are putting their lives in jeopardy in Iraq and Afghanistan. That's part of that statistic.
No, it's not. Our lifespan has trailed behind Western Europe for 30 years, Dan, and during that period of time, we have not been involved in wars.
By and large, we're the policemen of the world. Certainly, for a lot of that time, Iraq, Afghanistan, those are not too many Europeans other than the British doing much about that. But
that's got nothing to do with this.
It's got close to 5,000 lives to do with it. That's people who die.
Over an 8-year period, 5,000 people. We're talking. 18,000 people this year are going to die in the United States because of our health care system. This,
well, one of the reasons many of them are going to die is because they don't know that they already qualify. Like something 9 million people qualify for other government programs, and they haven't signed up. So government is not a panacea.
Those government programs are not comprehensive primary health insurance, Dan. They are not primary health care. You can't walk into a doctor's office, pretty much regardless of any of those programs. You can't walk into a doctor's office and say, I've been coughing a lot lately. I think maybe I've got something in my lungs that might be lung cancer, but I'm not spitting up blood and I don't have any really serious symptoms. You do that and they'll say, wait until you're coughing up blood and then come into the emergency room. And at that point, it is too late. That's the state of health care in America for uninsured people.
Emergency rooms can't turn you away. You go to an emergency room for care, which is what happens right now for a lot of people who don't have plans. You go to the emergency room for care. We pay $1,500 a year per person for that kind of care. As a society, that's how they are getting treated. They're not lacking health care.
They are not getting preventative treatment. They're not getting counseling on preventative treatment. They're not getting early diagnosis in emergency rooms. The emergency rooms are not set up for that, and they will turn people away if people come in and say, I think maybe I should have a prostate exam because I haven't had one in a couple of years. Can you draw some blood and do a PSA on me and give me a poke? The emergency room will throw you out, and a year later you might die of prostate cancer.
So you want to talk about the 8 to 13 million people who don't have health insurance?
What I want to talk about is an entire system that's dysfunctional. We have insurance companies. This is a $1 trillion industry. We have insurance companies that are like leeches on our backs. They're sucking hundreds of billions of dollars a year out of us. They have succeeded with both the Republicans and the Democrats in getting things like Medicaid Part D, where the government isn't even allowed to negotiate with drug companies for decent prices. Everything has to be at full retail. This is an absolutely criminal system that is killing Americans, and I'm just astounded, Dan, Dan, because I know you to be a decent man.
But
I'm
the government
astounded that
system
you would support a system that is killing us simply because somebody's making a profit off it and they have some role in presumably in paying your paycheck.
No, actually, they don't. And it's, you know, I don't think, as far as I know, we don't get any health care money. So that's another bogus comment.
Okay,
but as far as the current system that is flawed also includes massive amounts of government flaw. The VA system with, you know, horrible problems in the VA hospitals. Medicare, Medicaid.
Dan, let me hang on just a second. You have to know that the military hospitals, which is not the VA system, the military hospitals have the highest ranking of customer satisfaction of any form of health care in the United States. The VA is second. Medicare is third.
Medicare is going to go bankrupt in a couple years. So
it won't if we fix it. If we keep the Republican Medicare Part D that's sucking $300 billion a year out of it and giving it to the pharmaceutical industry, yeah, it's going to have some problems.
It already had problems. And Medicare Part D is a hilariously screwed up mess that nobody should have voted for.
Absolutely.
I mean, we can at least agree on that piece.
Yes.
But,
for different reasons, but yes, we can agree on that.
But you're looking at the government solutions to this problem, and we know we have some healthcare problems. I'm not denying we have healthcare problems. Government solutions to these problems are just as bad or worse.
Dan, the whole point of insurance is to distribute risk over as wide a group of people as possible, and to ultimately be there for them when they need it. And, you know, insurance companies, yeah, they can make a profit. Historically, they have, but the obscene profits that are being made, I mean, you know, just the salaries of the top 10 CEOs, the top 10 insurance companies in the United States right now are enough to pay for full comprehensive health insurance for 100,000 people. I mean, this is obscene what's going on with these companies. If we the people, this is a natural monopoly. That's why antitrust protection has been granted to the insurance industry, which I also think is wrong, but nonetheless, there is no competition in this industry. It's a giant monopoly. If as a natural monopoly, just like fire, just like police, just like electric to your home, just like water, shouldn't we, the people, be providing this?
It shouldn't be a monopoly, and right now it's not. There are government plans. There's private industry. If you get a monopoly, which is a government monopoly, you won't have any options at all, and then that's when things really go bad. And you set this up.
Give me an example of one country where that's the case.
Did you see the Paul Krugman clip floating around just the other day? Paul Krugman asked a question. He said, he had some Canadians on his panel. And he said, how many people here in the audience are from Canada? A bunch of people raised their hands. And then he said, how many of you think you have problems with your health care? All the same people raised their hands.
Right.
And
had he asked, how many of you would trade your health care for Americans' healthcare? What you will find in Canada, and the survey was just done 2 weeks ago, nationwide survey of Canada, 11%.
Are they happy with their healthcare? No, they're not happy with their.
Nobody's happy with their healthcare.
Okay, so you're trying to do is create a system where you guarantee people are not going to be happy with it.
That's what we have right now is a system where not only are people not happy with it, they're dying from it,
and they'll be dying from the government plan as well. I mean, just because government takes over something doesn't mean it's well run.
Dan, nobody is suggesting government take over anything. First of all, the public option is an opportunity to buy into it.
No, the public option is set up so that it makes it very difficult for employers to maintain the care, and what they're going to do, they're going to dump people into the public plan. And so, you know, whether you like the estimates, I'm trying to remember the name of that company. The Levin Group. The Lewin Group. That's right.
Lewin Group is funded by United Healthcare. It is not an impartial group. I mean, go to sourcewatch.org and look at it. Dan, we're out of time. Let me give you something where I think we agree, and I would love to see this pushed. Thom Coburn, the Republican in the United States Senate, proposed that if there's a public option, all members of Congress must take it. Chris Dodd was the only Democrat who voted for it on the Senate committee, and I think you should be marshaling Republicans, and I should be marshaling Democrats to actually have that attached to any public option.
We plan to only marshal the right if they force something through. How about that?
There you go. Thank you, Dan. Dan Gainor, businessandmedia.org. Good talking with you.